Hello everyone, welcome to De-Roofing Dentistry. This is Dr. Krishali Arora and today's topic is Universal Tooth Numbering System. So, if you are a dental student, understanding tooth numbering is extremely important because it is used in charting, diagnosis, treatment planning, examination, and communication between dentists. So, by the end of this video, you'll be able to understand how the Universal Numbering System works. Identify permanent teeth numbers from 1 to 32. Identify primary teeth using letters A to T. And remember the sequence easily without confusion. So let's get started. So we have three systems for numbering the teeth. The first one is the universal system. Then we have the Zsigmondy-Palmer notation system and the FTI system. The universal system is most commonly used in the United States of America, and here in India we commonly use the FTI system. Okay, we'll get on to all three of these one by one. So let's start with the universal system today. The universal numbering system use numbers to label the permanent teeth and use alphabets A to T to label the primary teeth. So first let's learn about the permanent teeth. So we have 32 teeth, okay, and in this system we are going to start numbering the teeth from the upper right side posterior teeth, the most posterior tooth, that is the third molar. Okay, so we are going to start with the third molar here and upper right side, and we are going to move in the clockwise direction. So from the upper right side we are going to move to the upper left side, then we are going to move to the lower left side and then to the lower right side. Now again, this right and left side will be according to the patient's perspective and not our perspective. Okay, let's start numbering the teeth. Okay, I'm just gonna wipe this off. Let's zoom in. So maxillary right third molar will be numbered as 1. Second molar will be numbered 2. First molar as 3. So this is the upper right side and we are starting with the most posterior tooth, that is the upper right third molar. Okay, and then it's not about the most posterior tooth present in the mouth, but it will always be the upper right third molar. Okay, now the upper right second premolar will be 4, first premolar 5, canine will be 6, lateral incisor 7, central incisor 8. Left side central incisor will be numbered 9, lateral incisor 10, canine 11, first premolar 12, second premolar 13, first molar 14, second molar 15, third molar 16. Okay, so as you can see here, the upper arch will be numbered 1 to 16 from the right side to the left side. Okay, now we can move to the lower left side. Okay, let's see. So lower left third molar will be number 17. So remember this thing, lower will start with number 17, okay, and then upper will end at 16. 1 to 16 for upper. Lower left side third molar will start with 17. Second molar 18. First molar 19. Second premolar 20. First premolar 21. Canine 22. Lateral incisor 23. Central incisor 24. And here comes the midline. We have the right side central incisor 25, lateral 26, canine 27, first premolar 28, second premolar 29, first molar 30, second molar 31, third molar 32. So the lower teeth will be numbered from 17 to 32, that is from the left side to the right side. Okay, so we moved from the lower left side to the right side. Okay, and that is everything about the universal system for the permanent dentition. Now we can move on to the primary dentition. Okay, so the primary dentition is labeled with capital alphabets, capital letters from A to T. So for the upper arch, it's same. So we are going to move from the upper right side, maxillary right side, second molar, primary second molar in the clockwise direction. Okay, so upper arch from A to J and lower arch from K to T. So let's start naming the teeth. So we have our maxillary right second molar here will be our A, first molar will be our B, K9C, lateral incisor D, central incisor E, same E, then we have F, G, H, I and J, then we have K, L, M, N, O, P, Q, R, S and T. Okay, so yeah, that is how we will name our primary teeth. So uh, now you might wonder that why this numbering system is important. So imagine telling other dentists the patient has caries in lower right first molar. That can sometimes create confusion. But if you'll say that the patient has caries in tooth number 30, that is absolutely clear and there will be no confusion. Okay, and that's why tooth numbering system is essential in dental charting, prescription, clinical notes, radiographs, examination and communicating among professionals, because it's short and simple. Okay, then I've seen many students making common mistakes. Students are usually confused with right and left side. So always remember that the right and left side will be from the patient's perspective and not ours perspective. Then with which number lower arch starts. So after tooth number 16, the numbering continues with 17 on the lower left side. Okay, then mixing permanent and primary system. So the permanent teeth, we use numbers, and in the primary teeth we use letters. Okay, so that is very clear, and I hope after this video you'll not make any more mistakes with that. So to conclude, the universal tooth numbering system is a simple and organized method used to identify teeth. Permanent teeth are numbered from 1 to 32 and primary teeth are labeled from A to T. The numbering follows a continuous U-shaped pattern around the mouth. A proper understanding of this system is essential for clinical communication, dental charting, diagnosis, and treatment planning. So make sure you practice the tooth numbering regularly until it becomes automatic. Thank you everyone for your time. If you liked the video, please do share and subscribe the channel. Thank you. Bye bye.